Hello and welcome to The World Today on Channels Television. I'm Cynthia Array. It's our Africa Thursday, and so we begin in Sierra Leone. Now, many countries are taking steps to ensure that the Ebola virus or the spread of the Ebola virus is contained. And in Sierra Leone, students now attend classes by listening to the radio.
The first Ebola patient to arrive in the United States flew on a plane specially equipped and designed to prevent the spread of the virus. That patient, Dr.
Now, we apologize for that, but this next report, health officials are saying that as many as 100 people in Texas are being checked for exposure to the Ebola virus. The list includes potential or possible contact with Thomas Eric Duncan. That's a Liberian national diagnosed in Dallas on Tuesday. And public health experts are also working to reassure the public and medical workers that the virus does not endanger communities there. The Voice of America's Carol Pearson has more.
The first Ebola patient to arrive in the United States flew on a plane specially equipped and designed to prevent the spread of the virus. That patient, Dr. Kent Brantley, entered Emory University Hospital through a special passage to the isolation unit. During a news conference outside the hospital, Dr. Jay Varkey reassured the public that they were not at risk.
I can't think of a better place in the world other than Emory University Hospital to care for this patient.
Some hospitals in developed countries have isolation units equipped with their own laboratories. Technicians do all the lab work right in the unit. And yet not every worker at Emory was comfortable with having an Ebola patient there.
The feedback we got from our staff was this perception was that this infection is a death sentence, that this infection can have 90, nearly 100% mortality rates.
Varkey and the hospital's other infectious disease experts met with staff members.
We had key leaders, so in both nursing and as well as the medical staff, infectious diseases who actually rounded in the hospital itself, from nursing station to nursing station, from unit to unit, to make ourselves available to answer questions.
Brantley eventually recovered, as did a second patient, Nancy Wrightball. Dr. Rick Sacra, the third Ebola patient flown to the U.S., was successfully treated at the University of Nebraska Hospital.
Though my crisis has reached a successful end here, unfortunately, the Ebola crisis continues to spin out of control.
Modern hospitals in developed countries are far different from the situation in Africa, where more than 240 medical workers have contracted Ebola in recent months. Most hospitals lack the supplies to contain the disease. In this Ebola holding facility in Sierra Leone, at least 3 employees have died of the virus. Nurses recently protested in Las Vegas, saying they are not trained to treat Ebola patients. Surveys show many Americans are afraid the Ebola virus might spread inside the U.S. Dr. Thomas Frieden, the director of the U.S. Centers for Disease Control and Prevention, tried to tamp down concerns after a Texas hospital admitted an Ebola patient who had arrived last month from Liberia.
It's only spread by direct contact with someone who's sick with the virus, and it's only spread through body fluids.
Frieden says the Ebola virus is something to fear, but as more people get into treatment early, more people will survive.
Now, earlier I did tell you about Sierra Leone taking measures to ensure that the Ebola virus disease is contained. And one of such is by ensuring that students now attend classes by the radio, by listening to the radio instead of actually going to school in order to limit contact. Here's that report.
According to the World Health Organization statistics, children represent 15% of the recorded 3,091 Ebola deaths, mostly in Liberia, Sierra Leone and Guinea. But that number masks the broader impacts the disease is having on children. The dangerous nature of the disease means governments and aid workers are having to rethink how they look after them. As a new school term begins, some schools in Sierra Leone remain closed to prevent further spread of the disease. Keen to ensure homebound children don't miss out on education during the closures, the government in capital city Freetown is set to broadcast school classes to children via radio programs. Chairman of an association of teachers in the country believes the idea is the best option available while schools remain closed.
Make do with what you have at your disposal, and it will also strengthen our education system. It's better than the children sitting at home without being taught. And also it will help the teachers when they listen to experienced people presenting programs or lessons over the radio.
Radio presenters are ready to go all in to do their part to help.
I think such program will be very, very important because students are not going to school now because of the Ebola virus. So if we have such programs, in different radio stations where students could have themselves concentrated or listening to different programs on air, I think that will be an advantage.
With disease experts warning that tens or even hundreds of thousands may be killed by Ebola before it is snuffed out, aid workers are drawing comparisons to challenges children faced during wars in Sierra Leone and Liberia in the 1990s. Some people have voiced concerns about the safety and conduct of children who do not have classes to return to. Teacher Idrissa Kanu thinks a lack of organized structure like the school could lead to misbehavior.
The peoples also, they also have their own problems. Sitting in their homes or houses presently without going to school, their minds may be played away. Their minds will be triggered to do anything contrary to their educational programs. For example, stealing, gambling, fornication and all the rest of it.
Memunatu Toure, a civil servant and also a parent concerned for the well-being of her child, said she was worried about the risks children face when they are in the streets rather than at school.
Some of them are also out selling. And they are not even protecting themselves from this disease. They are at risk because they are out there selling, and when you go out, you see them, they are not protecting themselves. They are mingling with different people, so they are in high risk.
Zainab Tunkara Clarkson, the head of the Mural Tonk Pekin NGO, says people need to take advantage of the time children have on their hands to teach them about the dangers of Ebola.
Children are always playing outside. They're touching each other. They're hugging each other. Even if you say to them, don't touch, they're playing football. You see them every day doing such things. So it's about telling them, educating them.
Sierra Leone's government says at least 22 teachers have died from Ebola, highlighting how the virus is wrecking fragile social services. Hundreds of healthcare workers have also been infected across the region. Brima Michael Toure, who works for Sierra Leone School Broadcasting Project, says closing schools is a responsible course of action.
We have lost over 22 teachers in this fight against the Ebola virus, and so one would imagine that if we had let the schools open, obviously those teachers would have been interacting with the students, and God only knows how many students would have contracted the disease and how many families at home would have also contracted the disease as a result. So that's the reason why we closed the school.
UNICEF says that over the next 6 months, it hopes to train 2,500 Ebola survivors in Sierra Leone to care for children. Foreign governments are gradually rolling out the responses. Washington pledged this month to deploy 3,000 U.S. troops to build 17 treatment centers and train thousands of medical staff in the countries affected by the disease. But these forces are arriving slowly. Meanwhile, UNICEF says it has only received 25% of the $200 million it needs to help children and families affected by the crisis.
Kudos to the Sierra Leonean government there. Now, the United Nations World Food Programme, that's WFP, as well as UNICEF, are wrapping up their 25th joint emergency mission to deliver life-saving supplies and services in the most remote and conflict-hit regions of South Sudan.
The teams bringing assistance via plane and helicopter have now reached more than 500,000 people, including 100,000 children under the age of 5. The mission has been taking place in Pathai, a settlement in Jonglei State, where around 30,000 children and adults registered for assistance. Using a combination of airdrops and airlifts, WFP delivers food assistance and nutrition supplements, while UNICEF provides nutrition and basic health support, including immunizing children against polio and measles, and giving out learning materials and water, sanitation, and hygiene supplies. Children who are separated from their families or unaccompanied are registered to begin the reunification process.
The World Food Programme has mounted an emergency response operation where we're using airlifts and airdrops as well as river barges to get to populations in hard-to-reach areas of the country. These are people who have fled their homes to places which are safe havens in the Jonglei, Unity and Upper Nile states of South Sudan.
Aid agencies scrambled to avert famine in South Sudan by launching the world's largest humanitarian operation after fighting erupted in the world's youngest country in December. Some 10,000 people have died and 1.7 million, one-seventh of the population, have been displaced since conflict broke out between President Salva Kiir's government forces and rebels allied to his former deputy, Riek Machar. Most are sheltering in remote and hard-to-reach areas, and more than half of them are children.
We'll take a break now in the world.